I'm Eileen Hoban. I'm an ER nurse here at Hunterdon Medical Center.
I'm Wendy Rowan. I'm a longtime labor and delivery nurse and currently an educator.
We've decided to do our presentation today on death, dying, and bereavement in fetal demise.
Many people have had the experience either firsthand with a miscarriage or a friend or family member. It's relatively common. The support you get at that time makes all the difference in your coping and recovery.
Unfortunately, a lot of times women in either full-term labor or pre-labor will present to the emergency department and they won't make it to the maternity ward in time. And this is when imminent delivery happens in the ED and it's not, the best place for it. We do have Robin today, who is a perinatal bereavement nurse for the ED, and she presents this topic to the other ED nurses as a skill that she teaches.
Having somebody available to you when this happens in the ED, you're not with the doctor you expected to be with, you're not with the nurses that you may have already met. It's the environment and the support is really limited. So the training that Robin provides to the other ED nurses really makes a difference in helping them to support the woman and her family through this tragic event.
Good morning. So I'm Robin Gunya. I've been in the ED for 31 years. I am a certified emergency nurse, and I'm also involved in ED and hospital-wide bereavement. Over the years, I've taken care of many women experiencing pregnancy loss, and I'd like to now share how ED nurses can make a difference when it comes to perinatal bereavement care. So the National Perinatal Association states, when a woman comes to the emergency department with a threatened or impending loss of pregnancy at any gestational age, she's experiencing an event with emotional, cultural, spiritual, and physical components. A challenge exists in simultaneously providing the treatment that's both physically and emotionally therapeutic, including holistic and spiritual support for the woman and her family, and providing bereavement care. Just a couple of facts about perinatal bereavement. In the United States, 1 in 4 pregnancy ends in miscarriage. The nursing care of women experiencing in a miscarriage in the ED, like Eileen and Wendy said, does differ from that of those who go up to the labor and delivery environment. In most cases of pregnancy loss greater than 20 weeks, that's where they'll be sent to the maternity unit where that kind of support will be given. Labor and delivery units across the country have incorporated evidence-based practice standards, educated bedside nurses, and have policies and procedures that are specific to these women's and principles of perinatal bereavement. And they developed a standard of care for women experiencing loss over 20 weeks. In the ED, the unique emotional, spiritual, and cultural needs of women who experience a miscarriage before 20 weeks may be overlooked or neglected, not on purpose. Care is focused on the medical interventions and measures to promote physical recovery, lacking bereavement support, and acknowledging that the miscarriage may actually be considered a loss of life. Our Emergency Nurse Association has a position statement on OB patients in the ER, and it states emergency nurses have the opportunity to acknowledge the death of a child through supportive understanding, empathetic approaches, delivering news in clear language, and providing the appropriate education regarding psychological impact and physical symptoms that may persist after the miscarriage. Some barriers to providing this perinatal bereavement care are your own personal experiences with death. That experience with death early in a nurse's career sets a foundation of how the nurse will deal with bereavement in the future. If a nurse felt isolated, helpless, unsupported, this experience will impact future dealings with death, the care provided, and grief support for the patient and family. When nurses have had a positive experience, those who felt supported and mentored and didn't feel alone were able to develop effective coping responses and ultimately improve future care and support. Let's talk a little bit about grief and bereavement. Supporting a person who has experienced the death of a loved one, or in this instance, a pregnancy loss, is extremely difficult. There are ways to be supportive during the grief process, acknowledging that there's no correct way to grieve, no timeline for them to feel better. They have to go through this journey and the grief process in their own unique way. It's often difficult to know what to do or what to say. So we don't have to provide the solution, but the permission and opportunity to grieve. We don't need to save them, we need to support them. Some of the resources we have for perinatal bereavement in the ED. First off, we have a pamphlet and brochures on grief, and we have bereavement support groups that are affiliated in our area. We also have specific articles on miscarriage that we can give the patient. If they miscarry and they're old enough, we have actually special gowns and blankets that we can present if the family would like to view the baby. We can give them a emotional teddy bear that's kind of a reminder. And then the other thing is a grieving pin, so handle with care pin. So these are just a few of the resources that we have for our patients and families in the ED. So another important aspect in perinatal bereavement care is taking care of ourselves, care for the caregiver. So self-care is essential for ED personnel who deal with difficult or emotionally challenging situations. To be an effective caregiver and avoid burnout, you have to know your boundaries and limitations, realize you're not perfect, you're not invincible. It's okay to admit you're not handling it well and ask for help. Be able to say no, and then separate your own grief from that of your patients and families. In conclusion, supporting a person who experiences a loss can be extremely difficult. Many women will remember the care that they received during their miscarriage for their entire lives. ED nurses have an opportunity to make a difference, be that difference.